Sleep apnea is a sleeping disorder where a person, despite having a full night's sleep, is yet tired and exhausted. It is very common and also can be life-threatening in some cases. In sleep apnea, breathing stops transiently for seconds and then restarts. This process is repeated overnight, and the victim feels exhausted even after a full night's sleep. It is very common these days, especially in older and obese people. Male gender is more susceptible to it. There are various types of sleep apnea, such as obstructive sleep apnea, central sleep apnea, complex sleep apnea syndrome. Following are the few prominent symptoms of sleep apnea. Snoring loudly while sleeping is the biggest symptom of sleep apnea syndrome. If you are insomniac for a long period of time, you may have obstructive sleep apnea, continuous and repeated episodes of irritability while sleeping, sympathetic and sudden gasping of air during sleep, lack of concentration, headache in the morning. So the question arises when to see the doctor. Well, if you snore loudly during sleep, and it happens now for a long period of time, then you must see your doctor. In obstructive sleep apnea, muscles at the back of our airway relax. The airway is narrowed, leading to less oxygen delivery to the blood. Whereas in central sleep apnea, our brain fails in initiating response to our ribs and their muscles. Various reasons play a role in sleep apnea, such as aging, male gender, neck circumference. Thicker necks are more prone to sleep apnea. Fat deposits, excessive fats around the neck, are major causes of sleep apnea. People who are chronic smokers, patients of heart diseases, and those taking antidepressant medicine are more likely to develop sleep apnea syndrome. It is sometimes really very difficult for people with sleep apnea to maintain a balanced, healthy lifestyle. Such people are more prone to daytime fatigue. They lose their due attention to workplace and daily life activities. Psychological disorders such as being depressed, sad, short-tempered, and moody are very common in such people. If you are facing this problem, your partner might be deprived of good sleep because of loud snoring. Sleep apnea is the direct cause of raised blood pressure and heart disease. It is because of a narrowed airway, leading to less oxygen supply to the body. Ultimately, it raises blood pressure. There is increased risk for stroke as well because of obesity-related complications. Sleep apnea is diagnosed usually by a pulmonologist at chest department or sleep. Doctor will take detailed history, will check vital signs and symptoms related to this disorder. It would be better if you accompanied your partner to the sleep center, because the doctor will definitely ask many questions from your sleeping or bedroom partner. Nocturnal polysomnography and sleep tests are usually performed to make a right diagnosis of sleep apnea syndrome. Sleep apnea is a treatable medical condition. Mild to moderate conditions are easily treated with lifestyle modifications. Whereas in case of severe symptoms, other therapies such as supplemental oxygenation and continuous positive airway pressure, CPAP. If all remedies fail to get required results, then the doctor will recommend surgery to root out symptoms of sleep apnea forever. So people who are living with sleep should not be worried, as it can be managed and cured permanently. We would like to hear about your own experience with this topic. Leave a comment.